it's about 4 or 5 months of programming coming together. Even though this is a very small crowd, our doctors were aware of it. There were 2 other panelists that were from Ashiana who were exposed to COVID and they couldn't be here, which is good for all of us. And we are very grateful that they couldn't, but they sent Padma, who's also going to be our representative for Ashiana, it was previously called Asha for Women, and Ashiana is a cultural and social support group, and they help a lot in domestic violence and other initiatives that are of importance to women who are undergoing distress. So without further ado, I'm going to start the introduction. I will introduce Padma Putregu, who's our moderator. Padma is a dear friend of nearly 10 years. I know it doesn't feel like a long time, but I've known for a very long time. She's an agilist. She's a leadership coach. She's also my personal coach, and besides many other things. She's a great vocalist, but she hasn't sung a single song for me in many years. And she's also an amazing coordinator. I have never seen anybody with such amazing program management skills in my entire life. So I will let her lead the panel and introduce Dr. Raju and Dr. Palwa.
Thank you for those wonderful words, Aparna. I feel I can do all of that because I have your support. So thank you and good afternoon, everyone. It's very wonderful to see all of you. This is a small crowd, no doubt, but the impact that we can have can be long and it can be lasting. So thank you once again and welcome to this very important forum where I am in the presence of 2 very eminent doctors who make a lot of impact in the society, in the region that they're operating in, and in the circles that they are involved in. So I'll start with introducing Dr. Shobha Paluroy. Dr. Shobha Paluroy graduated from Sri Venkateshwara Medical College, and after getting married to Dr. Sri Nagesh Paluroy, she moved to Jamaica, West Indies. While working as an internist in Jamaica, she got interested in knowing more about brain and its pathology. So after moving to the US, she did her residency in psychiatry at Howard University Hospital in Washington, D.C., and did her fellowship in geriatric psychiatry at Zaka Hillside Hospital, which is a division of the Long Island Jewish Medical Center in New York. She is double board certified in both adult and geriatric psychiatry. She has been practicing in Lansdowne, Virginia for almost 20 years. I would also like to introduce Dr. Jamuna Raju. Dr. Raju is a psychiatrist with an established private practice in Northern Virginia. She has a degree from Nagarjuna Medical College in Vijayawada. After moving to the US, she completed her residency in psychiatry at the University of Maryland in Baltimore. She also completed a fellowship at the University of Maryland, further specializing in community psychiatry and addiction. She started her private practice in 2004, and she has also been a medical doctor for the Innova Fairfax Partial Hospital and several other substance abuse rehab programs in Northern Virginia. These have included Vanguard Services, Harrison House, Sagebrush, Encore, and the New Paradigm. She also worked as a psychiatrist with the Fairfax Falls Church Community Shared Services Board. She has volunteered in the past at health fairs conducted by the SSVT and other organizations. She also supports internships at her private practice for future medical students and provides pro bono services for patients in hard financial situations. Currently, she is the medical director at A Mission for Michael and continues to see her patients at her private practice in Arlington, Virginia. I'm very honored to be here, and I'm also representing Ashiana, which was formerly known as Asha for women, and I have been associated with them for 20 years now, and I have also been on their board before I took on a more important role of motherhood. So thank you, and I'm very honored once again to be here, and I'm looking forward to the impact we can make by spreading awareness. So with the intent of spreading awareness, I would like to start with you, Dr. Raju. Some awareness around mental health issues and depression, and what are the differences between the two, and what are the triggers?
Thank you so much, Aparna and Padma, for including me on this panel. Again, all the audience, and I know that a lot of entertainment is going on outside. Being here, listening to mental health is really important, and thanks again for coming. And I work mainly in two different settings, and the first one is in my office. Most patients come in with common mental health issues like major depression, generalized anxiety disorder, and bipolar disorder. The more complex cases I deal with involves combination of psychiatric disorders with substance abuse and trauma issues. I also provide routine medication management and detox treatment for drugs and alcohol. Second setting, I provide consultation services in inpatient substance abuse rehabs. I initially see patients within 24 hours after admission, mainly for post-acute withdrawal symptoms and addiction and mental health. I am available for the staff within 24 hours for taking care of their acute symptoms with medication management. Their non-medical treatment at those facilities involves individual psychotherapy, group therapy, other treatment approaches. We work together as a team to manage the patient care and outcomes. Psychiatric evaluation is like solving a puzzle. Each and every patient is unique. Sometimes it is easy and accomplished in one single visit, especially if the patient is already self-aware and educated about mental health. Sometimes it takes multiple visits to come up with a diagnosis and treatment. There is especially some patients, it's very true, who has a substance abuse, trauma and personality disorders. It is very difficult for patients to open up and talk about their emotional pain. And it takes time for patient to develop trust and be able to disclose their emotional pain. And you also need to gather collateral information from family members and other providers such as therapists to complete the picture. I really enjoy able to help my patients by putting the puzzle pieces together with them. Thank you.
Thank you so much, Dr. Raju, Dr. Paluroy. What are your, what awareness are you able to create for the audience here today? You can do a mic check. If not, you can take my mic. Mic check.
Hello. Good afternoon, everybody. As Padma mentioned, my name is Dr. Shobha Paluroy. I'm an adult and geriatric psychiatrist, and I've been practicing for almost 20 years in Lansdowne, Virginia. Like Jamna says, I have two-part practice. One is practicing in my private office, and I also see patients in nursing homes who are seniors with mental health issues. Talking about awareness of mental health is, do we all know that May of each year is a mental health month, mental health awareness month. And also, green is the mental health, color. Thank you for wearing green. We should have done that. Anyway, talking about the awareness, the main thing about, people are not knowing the impact and intensity of mental health issues is stigma. They think that, we all think, that, having a mental health problem is something which shouldn't have happened. And it is something wrong. And it's like, oh, we did something wrong, that's why we are going through this. No, it's just like having high blood pressure, diabetes. When we have high blood pressure and diabetes, we just go run to doctor, get the medication, and do things, But, this is also the same thing. If we have good mental health, mental strength, we can deal with anything in life. So the main thing, because regarding awareness, is lack of education. You know, right now as mental health providers and as the audience, we all should go together and work on this and tell people it's not anything wrong to see a doctor, get help. You know, there are lots of, help available right now. We are in, in a stage where we can get a lot of things done and we have a lot of help available. So please, if you have anybody who's suffering, just let them know that help is available. It's nothing wrong to have a mental health issue. And you talked about triggers. One thing I want to say is if we understand that blues are nothing but a soul, feeling bad internally. And if we can understand that point, it's, a lot of things can be done properly. So the other thing is, triggers. I would say we can divide these triggers in a few different ways. One, a new bride comes from India, leaving the culture, leaving parents, leaving, brothers, sisters, leaving job, leaving friends, and comes to a new country, where it's culturally it's completely different. And it's the husband, she doesn't know much about the husband. And no friends, it's a lot for a young mind to take that. That's a trigger to have a mental health issue. Mm-hmm. And also, the next phase, having children, no support, work, home, work responsibilities, it's a trigger. Mm-hmm. The next stage, children, teenagers, handling teenagers and, parents, loss of parents, lots of things happening in life, that's a trigger. Next stage, empty nest syndrome, empty home, syndrome, empty nest syndrome rather. And that's another thing, and then health issues after we start aging. These are all the triggers in life. And the thing is, so as we know that there is help available, please ask for help. What I say.
Thank you. I think that's the much needed education in terms of triggers. This is not working, so I'll just speak loudly. How about that? So, what are the different ways in which we talked about triggers, and I think we all go through those situations and we don't realize that, that could be a mental health issue, because we probably we lack the awareness to see those signs in ourselves, right? So I'm wondering, and Dr. Paluwai, if we can start with you, like what are the different ways in which these mental health issues or depression can manifest, and what age groups are most affected? I know you talked about, it could happen at any life stage, right? But in general, if you could share something about what are the most age groups that are affected, and are women at higher risk? Because this is a women's panel and we have more women here, plus we have our male allies here who could spread the awareness within their circles so that their loved ones can be taken care of. So are women at a higher risk for mental health and depression?
So Padma, you're right. Women are more susceptible to depression than men. Research proves time and again, because we have different responsibilities. So how does it present? It can present like anger, sometimes frustration, sadness, irritability, isolation, tearfulness, anything, sleeplessness, lack of energy, lack of concentration. And if it is not treated properly, I have seen people having suicidal thoughts, and sometimes they are suicidal completers too.
Oh my God.
So Yeah, it's a very serious thing. And also it can present as anxiety also. So the research says that 80% of the anxious people are depressed and 50% of the depressed people are anxious. So they go hand in hand. So again, you didn't ask me about what should be done. So
Yes.
I want the family involvement, watch your loved one to see what's going on. Why are you feeling this way? What is that I can do for you? And see, keep an eye with the loved one and take care and be an advocate for the family.
Yep, advocacy. Dr. Raju, I would like to hear from your experiences, what are the different ways this can manifest, and our women, what can you share for the audience here?
Yeah, I wanted to go back a little bit about the triggers, I think Shobha mentioned a lot of triggers, I wanted to add, I wanted to add more triggers. There is some external triggers.
It's going in and out.
Oh, I'm sorry. Or maybe this is not good. Hello? Hello?
Yeah.
Yeah. I think it is in and going, in and out.
On and out.
Yeah, on and out. Hello? Hello?
You're welcome to come to this table.
Hello?
There are 2 chairs there and one right next to me.
Yeah, sorry about that. Let's move closer because,
Hello? Hello?
Yeah, this
Yeah.
is what?
Hello?
No?
Hello?
Yeah.
Hello?
It's going up.
Hello? Yeah, it's going in and out. And I just wanted to mention a couple of more triggers, Yes, whatever Dr. Pallavi mentioned, those are great. Sometimes you lose a family member. That's a big trigger. And some other triggers are when you're watching TV, these wars, recently. And again, COVID, we lost a lot of family members and we saw a lot of pictures. That is a big trigger, So again, shootings. Recently, there's a shooting happened, Watching all those pictures in the news, some of them, it is a big trigger for a lot of people. They get into more depressed, And again, losing a job, and sometimes you move from one place where you lived 15 years and, move to a different location where you don't have any family members and, no friends. That becomes a big trigger for some people, And again, you also need to understand, I know we're females here, drug and alcohol is a trigger too, It can increase your depression. You're, prone to have a depressive symptoms because of genetic tendencies. It can increase that. And again, some medications can cause, depression too. You need to watch out the medications. So some of these things you need to be aware of what's going on with those, and that really helps, So those are the ones that I wanted to mention. And again, Padma is talking about, again, some of these symptoms, as we females, mild and moderate symptoms are the difficult ones that we minimize, And some of these things, because of, we have a lot of support from the family, I think that's one of the reasons until it becomes severe, we don't get help. That is what I see. The reason we have this one, and Aparna and Padma made this work for us, is we wanted to be aware of. And one more thing I wanted to say is mental health includes emotional and psychological and social well-being. And it affects thinking, feeling and act, how you act. And if you are not mentally stable, what happens? You can't take care of your physical health. Doesn't matter whether you have a hypertension and diabetes, if you are not capable of, don't have motivation and energy level, I don't think you can take care of yourself. And the important thing is mental health is more important than the physical health. You need to keep your mental health more stable, and then you can take care of your diabetes or hypertension, And diabetes, the reason is because you're overweight. If you're mentally not stable, how are you going to decrease your weight? So you need to pay attention to your mental health more than anything else. So again, the depressive symptoms, couple of things I want to talk about it is that we ignore or we minimize or rationalize.
Especially when we have a difficulty sleeping, what happens is, if we are not working, we send the kids home, school, husband goes to work, okay, I didn't sleep very well last 1 week, I'm going to take a nap in the afternoon. And you rationalize, I'm okay, I'll get up and I'll start doing daily work. You take care of the kids after they come home at 3 o'clock, and you don't even think that's related to depressive symptom. And again, gaining weight or losing weight, and we think that, oh, I'm 40 or 50 years old, it's okay, I'm going to, I'm gaining weight, it's not, after I have 1 or 2 kids, I'm, okay to gain weight. That's, those are the ones you combine 3 or 4 symptoms or 5, it meets the criteria for depression. And you need to be aware of what is going on with me. And one more thing I wanted to say is, if you're self-aware, you need to find out how you feel. It's really important about, how you feel and how you think. It's really, you need to tune into your emotions. And once you know yourself, then you know your functioning is declining, then you can compare yourself, there is something is going on with you, and then you can, help yourself, Again, because of our hormonal changes in our body, puberty, menstruation, and pregnancy, miscarriages, and all these things are high risk for us. We get twice more depression than men.
Wow, that was a lot of information packed right there, and I'm hoping that all of us can walk away with that much more awareness in terms of managing our, managing ourselves to observe and catch those triggers. And that brings me to my next question, Dr. Paluwai. What are the barriers for seeking help, and what help is available out there? You're doctors, you're in the profession, but I'm sure there are a lot more patients out there who have not, who are potential patients who have not sought help yet. So what are the barriers for seeking help?
But what are the barriers?
What are the barriers for seeking help?
Barriers, okay.
Yeah.
Thank you. Thank you, Padma. Barriers are, number one is stigma. Number one is like, oh, if I go to a psychiatrist, that means all my friends will say, oh, she's mad. So that's number one. Number two is, family support. So I see a lot of families, one thing, from my practice, I will say this. The family comes, wife is depressed, and it's a medication trial. We cannot just give one medication. It's not like we are treating an infection. If it is an infection, we do the culture, we know that, this antibiotic helps, and we give that antibiotic, boom, it works. Psychiatry, treating a mental health, mental illness is not like that. It's a trial and error. And so one medication doesn't help, and everybody wants a quick fix. So it doesn't work because it takes about 6 to 8 weeks for a medication to get into the system, get into the blood levels. Nobody has patience. So after, say, 2 weeks, oh, she's not doing well, I know what's going to happen. If I take her to India, she will be 100% better. So it's not like you're just temporarily, we are moving the person away from the situation. For how long? They'll come back again into the same situation. So what do we do now when the family is all together at one place and treat and see what is the best thing? So that is another barrier, not giving enough time for things to work. Again, as I said, the first thing is stigma. That's, nobody wants to come to psychiatrist. Yeah. Medications. treatment, there are lots of different treatment modalities available. Like a lot of help is available. Number one, medications. Yes. Number two, therapy. And the combination of medications and therapy, supportive therapy, it's about 80 to 90% helps the person. But, there is a 10% which needs to be done by the person. I'm sick, I'm sad, that's why I'm laying down in bed and, all day. It's not going to work, one has to help the medication to help her. So get up, get dressed. That's what I tell my patients, I know you're sick, I know you're sad, but what if you go, get up, brush your teeth, take a shower, change your clothes, have a cup of coffee, go for a walk. Come back and see how you feel, rather than staying in bed. Yes, doctor, but some follow, some go through the same situation. So medication, therapy, combination. Recently there are more advances, like the old thing is ECT, electroconvulsive therapy, which we do use it for really, really very severe, sad, suicidal patients. We have to save the patient. So that is the time we suggest electroconvulsive therapy, but that's not the first choice. There is something called TMS, transmagnetic stimulation of brain. It's not shock therapy. They put the electrodes on the brain for 5 days a week for about half hour, and then it's just stimulation of the superficial part of the brain, and that is about 5 times a week, about for 6 weeks or so, and about 50 to 60% of the people get better, but they still have to take medication. So the other thing is ketamine therapy. A new era of ketamine in treatment is also available. So there are lots of help available. Please ask for help. That's all I plead everybody. Please ask for help.
We'll open it up for questions at the end.
Thank you.
Yeah, Dr. Raju, if you would like to share, what barriers have you seen before your patients came to seek help? Like, what are all the barriers they crossed before they showed up in front of your office?
Public is everybody what other people think about, and we do that with everything, not just mental health. We have to live in with all this society, what other people think, what we wear and what necklaces we wear. Everything is always it's a stigma, and the society. So we can't take mental health like that too, and we need to move on with that too, And stigma about the personal. Again, when you are depressed, you also feel vulnerable, and that also becomes a big difficulty for you to move on and get help too. And confidentiality and trust. Again, patient, when you have a depression, you need somebody's support to move on with that, to feel trust and give some motivation to get some help. And again, trusting a provider, and you're opening up with this, painful emotions. And can I trust this provider? And can this provider can understand my emotions? And all those things are questions are going to pop up in your mind, And concerned about the character about this doctor, whether he's going to be able to give me a proper medication, going to spend enough time, and all those questions are going to come up. You should write it down. One more thing I'm going to say, move on. Before I move on, if you don't like the doctor, move on to the second one. You are the one paying the money, If he's not connected with you, and shop on. You do shop for so many groceries and other sarees and everything. Why not with the doctor too,
Sure.
And if you don't like it, change it. And again, difficulty identifying your mental health. And that is a big part of it. Again, I told you, mild and moderate symptoms are the difficult for you to identify unless you are aware of yourself, That's really important. And again, knowledge about the mental health, what the symptoms are, what is depression, what is anxiety, what is bipolar symptoms. That is also important, because we get a lot of complex cases. Sometimes we need to spend more time to, differential diagnosis with those, And again, the lack of accessibility. That means, especially we're all working nowadays, and mental health is the bottom of the list. When you're working, I don't have time to, seek a mental health professional, especially mild and moderate, unless if it is severe, So you don't have time to see a mental health professional to take time off. And again, if you're not driving, you have to depend on somebody else. So you don't want to do that too. You don't want to burden on somebody else. And again, if you don't have insurance, that becomes a problem. Mm-hmm. Especially medical, it covers, not the mental health, That's one more thing. And again, am I going to, disclose my, confidential stuff, especially abuse issues, sexual abuse, physical abuse, emotional abuse. Can I trust this provider? Are they going to talk about this information, confidential information, about somebody else? Those are the issues that's going to come up, And again, is this going to affect my job? Am I working for federal government? Are they going to stigmatize, I'm going to lose my job. Why should I go there, All those questions are going to pop up, And again, so what I'm trying to say is nowadays, all those things you can put it aside. You need to think about yourself to do a better, take care of yourself, function, and do a better job at work, be a better wife, be a better mother, And those are the things that you need to do. Again, a lot of treatments are out there. I'm going to start with a couple of things. I'm going to divide the mental health into 3 stages, mild, moderate, and severe. And the mild, I'm not going to ask you to go and see a psychiatrist right away, And first identify yourself, do lifestyle changes, exercise, eat healthy, and sleep 8 hours, and don't drink alcohol, don't do drugs, and don't smoke cigarettes, and again quit caffeine too, and that's also affect your anxiety symptoms. Do all those things, and if you still feel like you have more symptoms, and that goes into moderate, then you can grab a therapist and talk about some things. Not your friend. I'm not going to suggest that you need to see a friend, because they're not going to guide you in the right direction. Maybe a good friend, but they're not professional. They might not. Again, I told you, psychiatric evaluation is solving like a puzzle for a psychiatrist. You need to put things together, and that's what we need to do. And I don't think your friend can do it. She can give you a shoulder for you to cry, but she might not be able to put puzzle pieces together, And that's what you need a help in moderate, severe, symptoms. You need help. You can go to a primary care doctor. They can give you resources, therapists or some other, whether really it's depression or you can do something else, Or you can get some tests done if it is related to thyroid or related to some other hormonal imbalance. And you need to fill those tanks. Take some thyroid medication. Your depression might be better. And those things you need to take care of first. And then, you still have it, you need to go and see a psychiatrist. And there are medications, long-term medications, and, you can try immediately, you can decrease your symptoms. And they can talk about whether you need to take a long-term or, you can stop immediately after like a couple of months later. And that happens with moderate and mild and moderate. But if it comes to severe, and we will go to that level, and there are partial hospitalizations, and what happens is the difference between hospitalization and partial hospitalizations, when you have thoughts of hurting yourself or thoughts of hurting anybody else, and it's a safety issue, And if you are not taking care of yourself, not bathing, and your insight is not there, and you're not take care of yourself, and not making the right decisions, and that happens, and that is the time, you need to make a decision where you need to go. And a partial hospital is when you're safe, then you can go to partial hospital. There you need to stay there. You have group therapy, individual psychotherapy, and the relaxation techniques that they teach, and the doctor will be there and they stabilize you, and then you can follow up outpatient psychiatrist. But if you are a threat to yourself or others, then you need to be admitted into the hospital. And again, you can try different medications. Psychiatrists, again, you all know different medications. Dr. Pallavi mentioned about all the treatments that's available, and you can pursue those things. But one thing I wanted to mention about again is at least 50-60% of people not getting help, that becoming a chronic illness, like more than 1 year if you are not getting help. If you have a depression or anxiety symptoms, that becomes a treatment, becoming treatment-resistant depression, that becomes difficult to treat with the drugs. And that's what I wanted to make it up.
I just want to add one thing. Talking about the treatment modalities, sometimes it's very difficult for people to get access to a psychiatrist because of transportation issues, and some people don't drive and all those things. But there is telehealth available nowadays. What should I say? Thank you to COVID, or I hate COVID. But because of COVID, now insurance companies are allowing us to do telemedicine. So we can do telehealth to help the people. They can stay home, and we can send a link, and we can connect via video, and we can treat people. That's what we do to many of the patients. So that is available.
Thank you so much. If all of you heard Dr. Pallavi and Dr. Raju speak about the stigma, the confidentiality, and the safety around this, domestic violence is again it is prevalent. It is unfortunate, but it is prevalent. And I'm here to speak about that. Just to quote some statistics, and I've been associated with Ashiana, previously known as Asha for Women, for 20 years now. And I have done advocacy. I have seen survivors. I've worked directly with survivors of domestic violence. But just to quote a few numbers, in the last 20 years, we have helped 974 clients.
Wow.
And 739 children. I wish Ashiana did not exist. That would be my dream come true. You know why? Which means there is no domestic violence. The home is a safe place for women and children. And we also see that happening in seniors when it comes to senior care, and that's why Asha turned into Ashiana to extend our support for seniors too. Because we all will be in that state at some point in time, and have to deal with some mental health issues on our own. So thank you for the awareness that you created today. There are the Ashiana flyers on your table. There are some extra flyers, so please do pick up. We provide culture-specific help in multiple languages, and we support. We have supported survivors from India, Nepal, Sri Lanka, Bhutan, Burma, Pakistan, Afghanistan, and I think I already mentioned Sri Lanka. When it comes to confidentiality, because you are probably talking about your family members who are subjecting you to domestic violence and abuse on an ongoing basis, and some awareness around abuse, right? It is like a pattern of behavior. Typically when the first time the abuse happens, everyone is in that surprise mode, and then you probably would call a family member back home, and they'll be like, okay, probably that person was in a bad mood, just ignore it or something. That might be the advice given sometimes. It's like, maybe he's in a bad mood. And again, I want to make sure that I recognize that it could be spousal abuse, not just towards women. But since we are in the women's panel, I would like to double click or put the spotlight on women survivors of domestic violence. But that does not mean that spousal abuse does not happen. I do want to recognize that men get breast cancer too, but it's the women who we see higher numbers in women. So that's why the spotlight is on women survivors of domestic violence. So we take confidentiality very seriously, because I think there is a statistic that it takes a woman 7 attempts to be able to get out, to go out of a situation, because it's the situation, the abuse occurs, then things go fine. The abuse occurs, things go fine. And so you're always in this guessing mode. And so you always want to hope, because at times women are in love with that, because it's probably their first relationship they've had in their life, right? Via an arranged marriage or whatever. So they want this to work. And so it takes 7 or sometimes more attempts than that for them to seek out that help. So those are the barriers, because they always have this belief that things will work out, this is temporary. That's one barrier. The second thing is the stigma associated, what will people say? Or, I am in this elite circle and nobody will believe me that I am in this situation. So there are all these stigmas that are associated with domestic violence. And there is an article by the United Nations which says that domestic violence impacts generations, because the children become the unwanted victims of the situation. And it manifests itself in a myriad of ways. So what Ashiana provides is, we have support for interpersonal violence, senior services, children and youth services, awareness and prevention. What I am doing right now is creating awareness at this very forum. And partnerships and collaboration. We work with a lot of shelters. We work with the Indian Embassy, and we work with other sister organizations. We get calls from different parts of United States, because some cousin, some family member in India knows someone, and they heard of Asha or Ashiana, or they heard of probably another organization in California. Or I have gotten calls because my friend circle know that I'm very active with this work. They're like, okay, what help is available in California? So it's like they're trying to get help for their friends or for their loved ones. So we work with a lot of partnerships, and we create those partnerships and collaborations with other organizations which are in this field. So I do want to come back to this question about how can men and families be a part of the support system and Dr. Raju, I can start with you.
Yeah, sure. The way I wanted to tell you is, first step is, after you aware of that you have a mental health, then you find a provider, and once you go to the provider, I think family can be there, because when you have it, for example, the mental health, depression, whoever has the person who has the depression might not be able to do all the phone calls and find a provider and write all those questions, what she wants to know about the mental health. I think sometimes you can be there and help her through make a phone call and find a doctor and find out all the questions. So you can sit down with your wife or a daughter or anybody, mother, and write down all the questions, what you wanted to talk to the doctor, and be there for her when you go for a first appointment. And you can ask along, and that's a good support, for the first appointment. And after you understand about what's going on, and you can ask about the diagnosis, what's the treatment plan, how long the medication need to be taken care of, what are the things that you need to observe, whether the medication is helping or not, and so what are the side effects, how long the medication need to be taken,
And if there is any, if this medication doesn't work, what are the future treatment plans? All those questions, you can ask those questions, and then you can find out how whole treatment plan works. And then sometimes you need to help the patient until she gets better. And you also need to make her aware of every day, and also whether she's sleeping well, her depression is getting better. Especially when she's taking these antidepressants, within 2 weeks they can feel suicidal. That's one of the black box warning on the antidepressants. So you need to be there for her, and to watch out those side effects. Especially if they have a moderate depression, they're not themselves, and they do need family support. And that's one of the things. And what are the signs? What are the things that the depressive symptoms are getting better? We can help her to understand. Make sure that she's sleeping well, she's eating well, exercising every day, and taking her medications. And also sometimes if they have a thoughts of suicidal ideations, we don't want her to have her medications with her. I want somebody to give her the medications. Especially if I have a first appointment, if somebody is sitting outside in my private practice, I ask my patients, can I bring that family member inside? Teenagers, sometimes they don't want to do it, but I will convince my patient. I'll say, hey, I'm not going to disclose things that you don't want me to talk about it, but I'm here to help your relationship better. Can I bring him in? And I talk about the treatment plan for about 10-15 minutes at the end of my session. And again, same thing, science about why the treatment is not working. And that is the one more thing. It's good to talk about the patient and the family members, so you understand the whole scenario, how it is working. So it's good to have a family member, whoever that is, and talking about to get that help and everything, and give the resources and find a therapist. I also, again, in my opening thing, I told you I like to collaborate and gather the information from the therapist. I also ask them, are you seeing a therapist? Who is your therapist? I'll get a consent release and get that information from the therapist too. Again, putting the puzzle pieces together, and that is the way you find out more about the patient. They're not going to open up sometimes, You need to gather more information from the family members, therapists, other doctors, and all those things are really important.
Dr. Balu.
So the family support, is very important. Tell the person who is suffering that this journey we are going to make it together. That's what the spouse needs to be there for. It's like going to the doctor, sitting with her, with the person who is going through this illness, and like Jamna said, jotting down what doctor is saying. Sometimes when they are so depressed, they're so apathetic, they cannot even remember and they can't process what is going on and what the doctor is saying. So, sit down with the family, sit down with the patient, and be there. Write down all the whatever the doctor is saying, and and follow up when you go home. And then also help with the medication. Hey, it's okay to take the medication. I'm here. Let me be there for you. What do you want me to do to help you out to come out of the situation? That is support. Take her for a walk. Let's go to a movie. Take your medicine. Go to sleep. Let me see if I can make breakfast for you, lunch for you. So something to it's all support system, which is important. And also other thing is I wanted to say compliance is very important. Make sure the spouse is taking medications on regular basis. The other thing is when one is severely depressed, they can have suicidal thoughts. Like Jamna says, after 2 weeks after taking medication, during the time they're going to get worse before they can get better. So the worst time is the time where the spousal support needs to be there. So, make sure that they're not overdosing, be there and, take off. If you have to take off for family sake, take off for a few days. So, yeah, family, spouse especially is the most important person who needs to be there. In our situation, our spouses, men.
Thank you. And when it comes to survivors of domestic violence, the advocates play this support system. There are times when these survivors don't know how to drive because they're new to the country. They don't have bank accounts. They don't know how to take the metro. So the advocates provide all that support and take them through those baby steps of rebuilding their confidence, rebuilding their lives, and rebuilding their trust in relationships, right? There are a myriad of stories where we have good stories for Ashiana survivors who have rebuilt their lives and have built an abuse-free future for themselves. But it is with the support of institutions that provide, the advocates, relentless volunteers. But again, the survivor needs to step up to seek that support. And once again, I just want, my dream is for a home to be a safe space, and for organizations that help victims of domestic violence to cease to exist. That would be my high dream if we are able to create that awareness. And with that, I would like to open it up for questions.
Thank you so much. So for everybody who's been here, really appreciate you being here. Even though it's a small group, for those who are open, Dr. Palwai and Dr. Raju have opened themselves up for a continued relationship for this business forum, even after this convention is over. So you can either come through me so that you can connect with them, or if you want to connect directly with them, they're available, and Google them up. You will see their names on the flyers. Or if you need more information, please let me know. Same for Padma. Ashiana is online. They're very robust in how they offer their services. They offer confidentiality. So if you still need someone to be an intermediary, I am at your disposal. But again, feel free to hit them up. Now I think since this is a very small crowd, we will take questions, any questions that you may have.
And yes, Ajita, we'll start with you.
Thank you for the great forum and the opportunity given. I might have missed this early on, but still let me ask my question. When we talk about depression, as the doctor was mentioning, it could be malign, it could be the earlier stages. But I know folks who say, oh, I'm depressed. Whether it's a clinical depression or it's because they feel down, so they might be saying, I'm depressed. How do we identify